Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is outcomes measurement.
Definition: Outcomes measurement refers to the systematic tracking and analysis of health outcomes that result from medical care and interventions. These outcomes are used to assess the effectiveness of healthcare services, improve patient care, and guide clinical decision-making. Health outcomes can include clinical results, patient-reported outcomes, and other indicators that reflect the quality, safety, and efficiency of care provided.
Key types of health outcomes. 1. Clinical outcomes. These are measurable changes in health status that result from medical care. Clinical outcomes include metrics such as mortality rates, infection rates, hospital readmission rates, complication rates, recovery times, control of chronic conditions, e.g., blood sugar levels for diabetes patients. 2. Patient-reported outcomes PROs. PROs are direct reports from patients about their health status and how they feel after receiving medical care. These outcomes focus on the patient's perspective, including quality of life, pain levels, physical functioning, mental health, satisfaction with care. 3. Process measures. Process measures track the steps involved in providing care and ensure that best practices are being followed. Examples include adherence to clinical guidelines, e.g., timely administration of medications, percentage of patients receiving recommended screenings, e.g., mammograms or colonoscopies, medication reconciliation at discharge. 4. Functional outcomes. Functional outcomes assess how well patients can perform daily activities or maintain their usual level of functioning after treatment. This can include mobility, ability to work, or independence in activities of daily living, ADLs. 5. Utilization outcomes. These measures track the use of healthcare services, often focusing on the appropriateness and efficiency of care. Examples include emergency department visits, hospital admissions, length of stay in the hospital, use of diagnostic tests and procedures. 6. Financial outcomes. These outcomes measure the economic impact of healthcare services. Examples include healthcare costs, hospital readmission penalties, cost effectiveness of treatments, resource utilization.
Importance of outcomes measurement. 1. Improved quality of care. Outcomes measurement provides healthcare organizations with valuable data on the effectiveness of treatments and interventions. By tracking outcomes, providers can identify areas for improvement, adjust care protocols, and enhance the overall quality of care. 2. Informed clinical decision-making. Measuring outcomes helps clinicians make evidence-based decisions about patient care. By understanding which treatments lead to better outcomes, providers can tailor care plans to individual patients and improve health outcomes. 3. Patient-centered care. Patient-reported outcomes, PROs, place the patient's perspective at the center of care, ensuring that the treatment aligns with their preferences, goals, and values. This promotes patient engagement and satisfaction, as care is personalized based on what matters most to the patient. 4. Support for value-based care models. Outcomes measurement is critical for value-based care, where healthcare providers are reimbursed based on the quality of care they deliver rather than the volume of services. By focusing on outcomes, healthcare organizations can improve performance, reduce costs, and achieve better patient outcomes. 5. Benchmarking and performance improvement. Measuring outcomes allows healthcare organizations to compare their performance with industry standards and benchmarks. This enables them to identify best practices, set performance goals, and drive continuous quality improvement. 6. Accountability and transparency. Reporting health outcomes increases accountability for healthcare providers and organizations. Publicly reporting outcomes data helps patients make informed decisions about where to seek care and encourages providers to maintain high standards of care.
Challenges in outcomes measurement. 1. Data collection and standardization. Collecting accurate, reliable data on health outcomes can be challenging, particularly when data comes from multiple sources, e.g., EHRs, patient surveys, claims data. Ensuring that data is standardized across different systems and providers is essential for meaningful outcomes measurement. 2. Risk adjustment. Comparing outcomes across different patient populations can be difficult because patients may have varying levels of risk or severity of illness. Risk adjustment is needed to account for factors like age, comorbidities, and socioeconomic status, which can influence outcomes. 3. Patient engagement and reporting. Obtaining patient-reported outcomes (PROs) can be challenging if patients are not actively engaged in their care or if the reporting process is cumbersome. Ensuring that patients provide timely and accurate information about their health is critical for measuring outcomes effectively. 4. Lag in data availability. There is often a time lag between the delivery of care and the availability of outcomes data. This can delay quality improvement efforts and make it harder for providers to act on real-time performance insights. 5. Resource and financial constraints. Implementing an outcomes measurement system requires significant resources, including technology, staff training, and data analysis capabilities. Smaller healthcare organizations may struggle with the financial burden of tracking and reporting outcomes.
Best practices for effective outcomes measurement. 1. Define clear and measurable outcomes. Establish clear, well-defined outcomes that are relevant to the specific patient population and care setting. Use evidence-based guidelines and clinical expertise to select the most meaningful outcomes to track. 2. Use standardized measures. Ensure that outcomes are measured using standardized tools, coding systems, e.g., ICD-10, SNOME-CT, and reporting protocols. This enables consistent data collection and comparison across providers, organizations, and regions. 3. Leverage health information technology, RHIT. Utilize electronic health records, EHRs, clinical decision support systems, CDSS, and health information exchanges, HIEs, to capture and analyze outcomes data efficiently. RHIT enables real-time tracking of patient outcomes and streamlines data sharing across healthcare teams. 4. Engage patients in outcomes measurement. Involve patients in reporting outcomes by using tools such as patient portals, mobile apps, and surveys to collect patient-reported outcomes, PROs. Educate patients on the importance of providing feedback about their care to improve quality and outcomes. 5. Conduct risk adjustment. Use risk adjustment methods to account for differences in patient populations when measuring outcomes. Adjusting for factors such as age, comorbidities, and social determinants of health ensures that outcome comparisons are fair and meaningful. 6. Promote continuous quality improvement. Use outcomes data to drive continuous quality improvement initiatives. Regularly review outcomes, compare performance to benchmarks, and implement changes in care processes to improve clinical results and patient satisfaction.
Future trends in outcomes measurement. 1. Predictive analytics and artificial intelligence (AI). Predictive analytics and AI will play a larger role in outcomes measurement by analyzing large datasets to predict patient outcomes, identify high-risk patients, and recommend personalized interventions. These technologies can enhance clinical decision-making and improve population health management. 2. Patient-reported outcomes (PROs) integration. There will be an increasing focus on integrating PROs into routine care and outcomes measurement systems. As patient engagement tools become more sophisticated, providers will have greater access to real-time feedback on how treatments impact patients' quality of life and satisfaction. 3. Social determinants of health (SDOH). Future outcomes measurement efforts will increasingly incorporate social determinants of health (SDOH) to better understand how factors like housing, income, and education impact health outcomes. Addressing SDOH in outcomes measurement will help reduce health disparities and improve care for vulnerable populations. 4. Real-time data and feedback. The shift toward real-time data collection and feedback will enable providers to respond more quickly to changes in patient outcomes. Advances in data analytics, wearables, and remote monitoring technologies will provide continuous insights into patient health, allowing for timely interventions. 5. Value-based care expansion. As healthcare continues to transition to value-based care models, outcomes measurement will become even more critical. Healthcare providers will increasingly focus on tracking and improving outcomes to align with performance-based payment systems and deliver high-value care.
Conclusion: outcomes measurement is essential for evaluating the effectiveness of healthcare services, improving clinical outcomes, and supporting value-based care models. By systematically tracking clinical, patient-reported, and process outcomes, healthcare organizations can drive quality improvement, enhance patient satisfaction, and reduce costs. For RHIT exam aspirants, understanding the components, challenges, best practices, and future trends of outcomes measurement is crucial for supporting effective health information management and contributing to better healthcare delivery.